Explain something here for you. And we're talking about lack of oxygen generally. That is one of the side effects of COVID-19. But the normal blood oxygen level should be 95% and above. When you have COVID-19, that can go lower, leads to hypoxemia, which then essentially is the lack of oxygen. Now, this is coupled with the lack of these things right here. That's an oxygen tank. And we're beginning tonight with the crisis in hospitals. And the Ministry of Health is tonight appealing to everyone to surrender the oxygen gas cylinders that are not being used for emergency care. Health Cabinet Secretary Kagwe says that the extra cylinders will help boost oxygen supply in the facilities for aid in the management of COVID-19 patients. This comes as the ministry admits there is an oxygen crisis in the facilities due to lack of oxygen gas cylinders and lack of proper piping, as Raquel Muigai reports.
The third wave has seen an increase in the number of critically ill COVID-19 patients, not forgetting those suffering from other diseases. And that has now pushed to the limit the public health system, especially in matters of availability of oxygen.
Last year, the total production and requirement for the industry was about 410 tons. That quickly went up around January to about 560 tons. We are now heading for a demand of double what we started at 410 at 880 tons. So where the situation at the moment is such that the industry is completely stretched.
A situation that the Biomedical Engineers Union and Association has also raised.
We mostly depend on the oxygen that is supplied through the cylinders, through the companies. But now, right now they are overwhelmed. Even if you call them now, they will tell you they can't supply even Nairobi Hospital, they can't supply KNH, they can't supply so many hospitals in time.
Ambulances are camping at the oxygen production sites to wait for even the last drop to save the patients.
But further away from the issue of demand lies the challenge of how to package the oxygen gas. The Ministry of Health citing that at least 20,000 oxygen gas cylinders rest idle in the hands of Kenyans and institutions.
These cylinders are required back to the industry immediately. Each cylinder costs about 40,000 shillings. And therefore, you can do the maths. The cylinders out there, to replace them would require a substantial amount of money.
Any cylinder you have in your hands can save somebody's life. And if it is not in use, it is actually being missed out in another hospital.
While private hospitals have managed to equip their facilities with correct piping for oxygen distribution to patients in the respective wards, a majority of the public health facilities have been relying on individual oxygen gas cylinders for every patient. Not only is the ministry pointing out the inefficacy in the old age system, but also the risk it presents in having a pressurized cylinder next to a patient.
People are pushing cylinders because piping is not done. That needs to be done in the right way, from the beginning to the end, in all the wards and in all the critical care areas. We need all the hospitals to be equipped with oxygen gauges, oxygen flow meters, humidifier bottles, and oxygen cylinder trolleys in order to be able to safely use the portable oxygen cylinders.
County governments have now been ordered to fast-track the piping of their public health facilities as the national government, through the Ministry of Health, seeks to address issues of effective running of oxygen plants through standardization policies to avoid issues of lack of spare parts.
We have around 70 plants, oxygen plants in Kenya. Most of these plants are in disrepair. And we need them to get working.
We know your orders have increased 5-6-fold in some cases. We are trying to serve all of our customers. We're not taking on any new customers. We're splitting all the production capacity that we have.
Gov't group of companies have pledged to donate oxygen to all government and county hospitals throughout the country, which can be collected from their Mombasa, Riru and Athi River factories. This comes as 137 patients are admitted at the intensive care unit, 91 among them being on supplementary oxygen. 902 persons have been infected with COVID-19, raising the positivity rate to 26.6%. 18 more people have also been confirmed to have succumbed to COVID-19, all of them being late death reports. Running out of oxygen in the middle of a COVID-19 third wave can only be described as a medical nightmare, and with the Ministry of Health depending on those who've hoarded oxygen gas cylinders to surrender them, such plants are working on the optimum to ensure that that gap is filled. Raquel Muigai, Citizen TV, Nairobi.